EV-103 is a global open label multiple cohort phase 1b/2 study, which looked at several settings in urothelial cancer and looked at EV monotherapy in some cohorts and EV and pembrolizumab combination in several cohorts. And the cohort for cisplatin-ineligible patients was the dose escalation cohort with 5 patients, and the expansion cohort A with 40 patients. Cohort K was a 1-to-1 randomization of EV and Pembro versus EV monotherapy in cisplatin-ineligible patients with around 151 patients. So as a background, for cisplatin-ineligible patients, treatment options have generally been limited, with gemcitabine and carboplatin as the only treatment option a few years ago, and now avelumab maintenance is approved for patients who do not progress after platinum-based chemotherapy, but there's a substantial number of patients who do progress and are not candidates for that. And PD-1, PD-L1 inhibitor monotherapy as frontline is indicated only in select patients. So based on the dose escalation cohort, cohort A and cohort K from EV-103, US already received the FDA accelerated approval of EV-Pembro combination in patients who are cisplatin ineligible. It had shown confirmed responses of 68%. The responses were rapid and durable. And we now presented the 4-year follow-up data from cohort A and the expansion dose escalation cohort. The mechanistic rationale for EV and Pembro combination comes from the fact that EV is an antibody-drug conjugate with a multifaceted mechanism of action. So that is mediated by intracellular release of MMAE, which leads to direct cytotoxicity of the Nectin-4 producing cells and indirect killing of the neighboring tumor cells. And it also induces the hallmark of immunogenic cell death. And in preclinical models, when a checkpoint inhibitor is combined with EV, there's complementary engagement of the immune system. And that's why pembrolizumab and EV were a rational combination.